Hi, I'm Dr. Dai Chung, Chief Medical Officer of the Joint Pediatric Enterprise between UT Southwestern and Children's Health. Welcome to this new segment of the In the Know video series. In these videos, I'll sit down with various physicians to shine a light on the clinical excellence, innovation, and medical advancements that are happening across our enterprise. I look very much forward to sharing this incredible work of our colleagues to transform pediatric healthcare in North Texas and beyond. Today we have Dr. Alex Kane, who's Professor of Surgery and Chief of Pediatric Plastic Surgical Program at Children's Health in UT Southwestern. Welcome, Dr. Kane.
Thank you. Glad to be here.
Well, what can you tell us about your program?
I am the Division Director of Pediatric Plastic and Craniofacial Surgery. We treat kids over a long period of time. We don't do sort of transactional surgery where it's sort of once and done. We have 3 full-time pediatric and craniofacial surgeons, which is reasonably unique in that we benefit from having the clinical numbers to support full-time pediatric plastic surgeons. That in itself is reasonably unique.
And I wonder if you can also share with us what sets your program apart.
We are completely pediatric. Most plastic surgeons that treat kids do it on a part-time basis. You need to make the investments in the programs and in the resources that children and their families really need. Children's has been willing to do that, and I'm grateful for that. As an example of that, our cleft team has 9 providers that are seen every time these children come to one of our Wednesday clinics, and we'll see 30 patients with each one with a unique version of a craniofacial condition on those days. I think for the kids themselves, I think also the fact that we're able to see children of all sort of socioeconomic and ethnic stripes that we have put in the resources to allow them to be seen and seen in their own language. These are kind of unique things that can't be replicated easily outside of this kind of an institution, and it's to the credit of the institution that they're willing to make those investments to allow these kinds of programs to grow and to survive.
What are some innovative or unique programs that you are building out?
So we have, for example, the vascular anomalies team. That is another multidisciplinary program. There are conditions that were sort of orphaned out there that aren't of such prevalence that they would be necessarily have a home with a single provider. These kinds of conditions where children are born with vascular birthmarks, they could be tumors or just collections of different sort of vessels in their bodies that are malformed that can cause problems that are very unique to each child. To care for them, you need to have a group approach. You have to have a hematologist involved. You have to have a dermatologist involved. You need to have surgeons, plastic surgeons, ENT surgeons. And again, you have to have interventional radiologists available who are super subspecialized in treating these kids with, very, very complex, nuanced approaches. So we're able to offer that through the team and through these collaborative kinds of enterprises. We have a hand and peripheral nerve program. So, kids are born with congenital conditions involving their hand. Many people don't realize that plastic surgeons deal with hand problems. We do. We take care of, half of them in terms of those that come to our institution. If we have hand surgeons who have special additional training after their plastic surgery training, dealing with those sorts of problems, either acquired problems or congenital problems. Many children are born with problems involving the peripheral nervous system, whether it be problems with facial nerve function, where parts of their face are not moving appropriately or as is designed. We can try to assist with that. We have just established in the last couple of years, and I'm proud of it, the first 22Q team in Texas. Again, it's a team approach. These children have a specific genetic condition whereby they may have a cleft palate, they may have speech problems, they may have neurodevelopmental issues, they can have endocrine issues, they can have cardiac issues. So again, you have to have all of those people in the game. The thing that comes top of mind when people think of plastic surgeons is things that are more related to form, which doesn't always leave a lot of thought to the idea of function. I think on the pediatric level, we're always dealing with form and function. Whether it be we repair a cleft lip, for example, for the purpose of form, but we also repair it for a very significant component of function. We want people to be able to smile and to eat appropriately. We repair a palate. People aren't looking in people's mouths at the palate, and many people wouldn't even know one would have a cleft palate unless they listened to their speech. If you don't have a functioning palate after a palate repair, that is a significant obstacle for development and for success in the society in which we find ourselves. So, we're always dealing with form and function, and it's hopefully a happy marriage between those two.
I wonder if you could tell us a little bit more about this analytic imaging.
It's a mouthful, right? So,
it is.
So we developed, we had this idea about 10 years ago now to come up with something called the AIM Center, which is an acronym standing for the Analytical Imaging and Modeling Center, as you just said. So what is it? Again, it's about form and function. So we are interested in how people look and how we affect change based upon the procedures that we do, okay? So let's say we take a child with a cleft lip, for example. They'll come in and they will have a particular appearance and they will have a particular form. What if we wanted to push the boundaries of our discipline and try to say something meaningful about what a group of children with cleft lip have? What is happening with their nasal condition? What is happening with the lip itself? Well, you can take a picture, a conventional photograph. You can take a 3D picture, which is a whole bunch of cameras aimed at the same time, no x-rays involved, and take those pictures so you can have a static 3D image of that condition. If you want to look at how the child is smiling afterwards, what you really need is a 3D image over time, like a 3D movie. What the Analytical Imaging and Modeling Center brings to the table, and again, I was very gratified to have Children's invest in it, was sort of kind of a first of its kind, certainly in Texas, where we bring together these imaging modalities, none of which involve x-rays. So, and the purpose of this unit was to bring together all the resources, both the imaging resources, so plain 2D photography, 3D cameras, 3D movie cameras, a 3D printer, software, PhD level talent to sort of harness that. So, and it was not just for plastic and craniofacial surgeons. The idea is that we have a unit that brings together a resource core center for, it could be anything from treatment planning, so before the surgery, it could be outcomes research, it could be looking at a group of patients before or after surgery, it could be prototyping of novel devices, intellectual property, and it's sort of a center that is available to any faculty or any of the providers here at Children's. And then we can help bootstrap the analysis of the data that comes back from all those different modalities.
How did that concept, whose idea was it, or how did it all originate?
It was my idea, and I sort of sprung it on people when I was being recruited here, and somehow it happened. So I'm very grateful to Children's for indulging it, but I think it's paid off.
Yeah. So how should the colleagues in our system, really curious and particularly how should they contact you?
Just call. Email. They can come by. There's, we have a scientific, a PhD, Dr. Halak, who's available at all times to discuss this thing. Just it's informal, but we're here.
Right.
We see ourselves as plastic surgery is always known to be the surgeon for surgeons. So we're a consultative service, right? So when there are problems that require our expertise, we want to make ourselves available. We want to be affable. We want to be agreeable, and we want to do the job that's necessary to take care of these kids. That's our mission, and that's our lifeblood.
Great. Well, thank you very much for sharing some of the insight about your program today.
My pleasure. Thanks for having me.